ओम कर्पूर गौरम करुणावतारम संसारसारम भुजगेंद्रहारम सदा वसंतम हृदयारविंदे भवम भवानी सहितम नमामि. Let me share. The topic is Chandraprabha vati and its clinical indications. Chandraprabha vati is a medicine which is commonly given in urinary tract disorders and in gynecological disorders. So it contains mainly Gugulu and Shilajatu also and Swarnamaksha Vasma, and it is effective in various disorders. When given with suitable disease-specific adjuvants, it gives a good outcome in various type of disorders. So herbal-mineral formulations are becoming popular in the current medical practice and are often used by Ayurvedic physicians. Pravada Panchamrita Rasa, Matanjay Rasa, Agnitandivati, Yogaraja Guru, Kaishara Guru, Sutashekar Rasa, Shasakutar Rasa, Makarajavati are few such formulations which are used to both acute and chronic disorders and especially in non-communicable disorders. There are least adverse drug reactions after the even after prolonged usage of this medicine. Chandraprabha is one such preparation, herbal mineral formulation, which is used especially in gynecological disorders, urinary disorders, and pain management. Apart from some herbal drugs, mineral drugs like Swarnamaksha Basma, Shilajatu, and Gugulu are main ingredients of this formulation. Apart from disease-specific usage, it can also be given to increase the hemoglobin percentage and is useful in as Vayastapana, Rasayana, and anti-aging also. The present paper highlights about the clinical indications of Chandraprabha tea in an experiential and scientific view. So, Ayurveda is the indigenous system of medicine which is directed to both disease prevention and cure of the disease. Ayurveda explains the use of herbal, herbomineral, and animal origin medication which are used in the management of various disorders. It explains the use of non-medication measures also like Dinacharya, Rutucharya, Durutta, and Achar Rasayana for the prevention of the disease occurrence. Use of Patyapatya also given importance in the management of diseases. Various herbal mineral formulations are used in the treatment of diseases. Chandraprabha is one such preparation which is used in the management of urinary and gynecological disorders and also pain management. Is arterial histology. In the arterial also, Chandraprabha acts as Sotra Shodhaka. Here you see the tunica intima, tunica media, and tunica externa you see in the arteriole, and the Chandraprabha containing Shilajatu acts as Sotra Shodhaka in this. Skin also it acts. This is the papillae. The skin also histology. So skin also Chandraprabha acts. Skin. Then in the kidney histology, there is centrally you can see glomerulus, stuffed capillaries surrounded by Bowman's capsule and drain infiltrated into the proximal coronary tubule, Henle's lobe, distal coronary tubule, and collecting duct. This is the kidney system, the kidneys, the ureters, and bladder and urethra. So Chandraprabha acts mainly on the urinary tract. So this is again histology of kidney. You can see the cortex containing the glomerulus, stuffed capillaries surrounded by Bowman's capsule, and the urine is infiltrated drain into the proximal coronary tubule, Henle's lobe, and distal coronary tubule, collecting duct. This is the Shilajatu, black vitamin, which is an ingredient of Chandraprabha tea. The Triphala also ingredients of Chandraprabha tea. So usually in diabetes, Chandraprabha tea has a good action. Diabetic carbuncles, multiple opening with the, so it is seen. So carbuncle, it is effective. So let us see the clinical indications of Chandraprabha tea. Madhumeha, Prameha, renal calculus, Mutra Krichra, Mutragata, Mutradaha, dysuria, anapatyata, that means infertility, leukorrhea, menorrhagia, metrorrhagia, polymenorrhea, katishula, sandigatavata, this is John sandigatavata, grivashula, and cervical spondylosis, and also frozen shoulder, lumbar spondylosis, lumbar spondylolisthesis, disc prolapse, backache, anemia, and dysbeulia. And also see chronic kidney disease, nephrotic syndrome, pedal edema, chronic non-healing ulcer, deep vein thrombosis, and peripheral vascular disease. So in these disorders, Chandraprabha acts. Let us see the Amayaka Praga. When Chandraprabha is given with along with disease-specific adjuvants, it gives desired results in various disorders. Like in Madhumeha, it is given with Asanadikvata or Katakatradikashaya and Godantikasma. In Prameha, it is given with the Shiva Gutika and Vasanta Kusmakara Rasa. In BPH, benign prostatic hyperplasia, it is given with the Varunadikashaya and Gandakarasayana tablets. In renal calculus, it is given with the Varunadikashaya or Prameha Kashaya. In Mutra Krichra, Ashmira Kashaya. In Mutra Krichra, it is given with the Gandakarasayana and Sarivadasa or Chandanasva. In Mutradaha, it is given with the Chandraprabha water and Chandanasva. In dysuria, painful micturition, it is given with Gandakarasayana and Sarivadasa or Ushirasava. In Anapatyata, that is infertility, is given with the Ashokarishta in females and Ashwagandharishta in males with the Yatavari Guda. In leukorrhea, Shetaprada, it is given with the Ashokarishta or Ushirasava. In menorrhagia, it is given with the Chandrakala Balabhadrasa, and Ushirasava. In metrorrhagia and polymenorrhea also similar medications are given. In Katishula, it is given with the Maharasana Kashaya and Vishasinduka vati. In Jana Sandigatavata, it is given with Maharasana Kashaya and Maha Narayana Thala for external application. In Grivashula, it is given with the Vishasinduka vati and Maharasana Kashaya with the Griva Basti. In cervical spondylosis, it is given with the Basti, that is Matra Basti, and Maharasana Kashaya internally. In frozen shoulder, it is given with Kaishara Guru and Rasna Sapta Kashaya and Griva Basti. In lumbar spondylosis, it is given with the Balarishta, Trayashama Guru, and Kati Basti. In lumbar spondylolisthesis, it is given with the Kati Basti, Matra Basti, and Vishatsindakavati. In disc prolapse, it is given with the Vishatsindakavati, Maharasnadi Kashaya, and Shifali Patra Swarasa. In body ache, it is given with the Balarishta, Navaya Saloha, and Dashumalarishta, Draksharishta. In anemia, it is given with the Navaya Saloha and Lohasava. In Daurbalya, weakness, it is given with Ashwagandharishta and Chandraprabha. In chronic kidney disease, it is given with the Varunadikashaya, Pranamadi and Udantivasma. So in nephrotic syndrome, where heavy proteinuria is there, it is given with Varunadikashaya and Amrutadikashaya. In bilateral pedal edema, it is given with the Pranamadi and Pranamasa. Bilateral pedal edema may be due to cirrhosis of the liver or due to cardiac causes, cardiac failure, or due to CKD. So we have to evaluate the cause and treat the cause. Along with that, it can be given. In chronic non-healing ulcer of the skin, it is given with Shivagutika, Sarivadhyasava, Mahara Manjishtari Kashaya, and Prahala Panchamutarasa. You can also give Trifala Guru and Gandakarasayana. In deep vein thrombosis, it is given with the Maha Manjishtari Kashaya, Shilajataloha, and Prahala Panchamutarasa. In peripheral vascular disease, it is given with the Maha Manjishtari Kashaya, Shivagutika, and Mukta Panchamata Rasa. Coming to discussion. Chandraprabha is a Gugulu Kalpa, which is Karliya Rasayana, which is given in gynecological, urinary disorders, and pain management. It acts as Rasayana, Satashodaka, and Vedanastapaka also. Renal calculus, burning micturition, urinary tract infection, benign prostatic hyperplasia, diabetes mellitus, menorrhagia, metrorrhagia, polymenorrhea, dysmenorrhea, and infertility. These are in these diseases, it gives good result. So the main ingredient being Gugulu, Shilajato, and Trivangavasma, and Sarnamaksha Basma. Gugulu is Vedanastapaka, Sotashodaka, Medohara, Medonilahara, and hypocholestemic also. Shilajato is Rasayana, Mutrala, and Sotashodaka in action. Sarnamaksha Basma is Rasayana, Raktadatwardaka, and sedative also. Low Basma is Rasayana, emetinic, and balya in action. In nutshell, Chandraprabha can be given generally in all age, uh, usually after age of 35 years. It has a regeneration action also. Coming to conclusion, Chandraprabha is a tonic and rasayana and can be given in commonly after the age of 35 years. Having Gugulu, Shilajuta, and Swarnamakshi Vasma, it is having Vedanastapaka, Rasayana, regenerative, and Satashodaka actions. As it is diuretic also, it can be given in Shotapradhana disorders. As it is having Gugulu, it can be given in various Vedana Pradhana and chronic diseases. So these are the references. Thank you for patient hearing.